Good afternoon. I'm Velshi. We are following breaking news. 4 passengers aboard a Holland America cruise ship that was trying to get to Fort Lauderdale have died. 2 people have tested positive for the coronavirus on that ship. Right now, we know approximately 300 Americans are aboard that ship. It is unclear if any of them are the victims. NBC News correspondent Sam Brock joins me now with the latest. Sam, what have you got?
Ali, good afternoon. It is the Zandam. That's the name of the ship. And right now there's 1,800 people on board that ship that are waiting to figure out how this is going to play out. All of them, the passengers anyway, quarantined inside of their rooms as testing is administered, as they transfer people from one ship to another. There's a sister ship, the Rotterdam, that met them in Panama, and they're in the process right now, according to Holland America, parent company for that cruise ship, of moving healthy people after they've been tested from one ship onto the other. Now, I just spoke with a couple of passengers, Cliff and Doris Colber, who left on March 6th. That's when they boarded in Buenos Aires, Argentina, and they were supposed to end up in Chile, Santiago, Chile, 2 weeks later. And of course, this whole thing erupted since then. What they told me when I spoke with them on the phone was that on March the 4th, the governor of the state, Ron DeSantis, said to Floridians, "You're at low risk. Continue living your lives. Don't disrupt what you're doing." They said that then 2 days later on March 6th, President Trump issued a statement to America saying that this was all going to be under control. They felt that that was strong enough to continue with their plans. They got on the ship, and here they find themselves today. In terms of the number of people that are potentially affected, Ali, we know there's roughly 53 passengers and 80 some odd crew members who have all exhibited some sort of symptoms that have gone to the infirmary on this ship. And the question now becomes, as they try to test as many people as possible throughout this process, how are they going to get the passengers back to Florida? It's supposed to come through the Panama Canal if they can get permission, and then dock in Broward County, which is about 30 or 40 minutes from where we are here in Miami. But the government in Broward County has not signed off on that yet. So you have all of these passengers, Ali, who are wondering what their fate is going to be. And the local government officials right now cannot agree on a plan of action. 4 people have died, as you said, and who knows how many that might be, where that number might rise as the days proceed. A very scary situation. Back to you.
Sam, here's what I'm not understanding, notwithstanding the fact that the governor of Florida did say go about your lives, and the whole world knows that Florida should have shut down its beaches and should have shut down spring break and all that kind of stuff. Notwithstanding that, are there more ships out there that are trying to dock in America that we didn't know about?
They've shut down operations here for weeks in the Florida area, not that I'm aware of at the moment. That doesn't mean that there aren't, but this situation clearly is garnering headlines right now because of just the sheer quantity and potential of how many people could be sick, which is exceedingly unsettling, especially when you consider the demographic of who's on these cruise ships to begin with. Many people who are a little bit older in age, and we know they are giving priority right now to those in their 60s, 70s, and 80s.
Sam, thanks for your reporting. We'll stay on top of this one. Sam Brock is in Miami for us. If anybody does know of anybody, if there's a cruise ship of people still looking to dock, please tweet me about this at Velshi. This is kind of remarkable that the governor of Florida would have known there was a cruise ship on the way, and we're now just dealing with this. There's help on the way for some people in America, for some people and some businesses and some hospitals that are just struggling to deal with this growing coronavirus pandemic. In a voice vote, the House approved a $2 trillion relief package that includes direct payments to Americans, a boost in unemployment insurance, money for hospitals and state and local governments. The bill now heads to President Trump's desk, but not without a little bit of drama. Kentucky Republican Congressman Thomas Massey tried to force lawmakers to vote on the record, but he was rebuffed, an effort that forced lawmakers to quickly return to Washington. House leaders praised lawmakers for coming together to get this package approved.
We're so pleased today to be able to have passed on the floor practically unanimously this important bill, CARES. And we want to demonstrate that we do care for the American people in every way.
With the passing of this bill, you will see that we will fight it together, and we will win together. And I want to thank our colleagues for that type of work.
As the House debated that bill, President Trump lashed out at Ford and General Motors on Twitter for not moving fast enough to produce medical supplies. It's not clear if he's using his authority under the Defense Production Act to force them to do so. Ford said in a statement that it is, quote, pulling out all the stops to quickly and safely provide vitally needed equipment for patients first responders and healthcare workers. General Motors announced it was bringing workers back to its plant in Kokomo, Indiana, to begin making ventilators. Now, all of this comes as the number of cases continues to skyrocket. There are now 94,000 confirmed cases in the United States. More than 1,400 people have died. We should note, most people who get the virus will recover, and most people who die do so because there is an underlying illness. South Carolina Democratic Congressman Joe Cunningham has become the third member of Congress to test positive. Also testing positive for the virus, British Prime Minister Boris Johnson, along with his health secretary and his chief medical officer. Back at home, the Navy hospital ship USNS Mercy has arrived at the port of Los Angeles today to help ease the burden on hospitals that are overwhelmed by coronavirus patients. In theory, these hospital ships are meant to treat people who are not suffering from coronavirus, but who are otherwise requiring medical care. There's a ship headed, by the way, for New York Harbor, too. It is leaving tomorrow. Wall Street seems to be ending this historic and tumultuous week on a down note, although you can see it's getting less down as the day goes on. I'll keep you posted. Right now, we're just 2% off. It's very rare that you actually see these days just a 2% swing on these markets. As you can see, all major markets are in the same position. I will bring you up to speed on where markets are at the end of the show. Let's get to the House voting to send this pandemic relief bill to the president's desk. Garrett Hake joins us now from Capitol Hill. Garrett, this drama we were talking about, this Congressman Massey of Kentucky, he seemed to be determined that everybody who votes on this bill has to do it in a roll call vote. They have to be on the record. What was this about?
Well, look, and he was among the targets of the president today in those tweet storms. The president called him a third-rate grandstander and said he got to be kicked out of the Republican Party for this. Congressional leaders wanted to bring as few members as possible, as few as absolutely necessary, back from around the country to Washington to try to conduct this vote in as safe of a way as possible. They were very frustrated that Thomas Massey wanted to have this vote on the record. Here's how he explained his objection to doing this by voice vote when he talked to reporters after leaving the Capitol. Take a listen.
Well, they're trying to cover up their votes. They had enough people there to pass the bill, but they still refused to have a recorded vote. And they told me they were trying to protect members.
Don't you believe that that's the case? There's 435 members in a room that can't hold that many.
No. They're trying to protect the members who are there from political ramifications. Like I said in there, I came here this week to make sure our republic doesn't die in an empty chamber by unanimous consent.
Allie, if you listen closely enough behind the congressman there, you can almost hear black helicopters circling. I mean, that's the level of conspiracy theory that's going on here to suggest that this is an effort to protect members from taking a dangerous vote. The Senate passed this bill unanimously. The House would have done so if not for his objection. There was widely perceived to be a real need to get this done as safely as possible, as the news about Joe Cunningham, which you just read, so clearly indicated. This is not a theoretical exercise for people who work up here on the Hill, who do not want to be put into a sealed off chamber for votes unless they absolutely have to.
Garrett, thank you for your coverage of this. Garrett Hake for us at Capitol Hill. I want to continue with our coverage of this, the House vote coming 2 days after the Senate unanimously approved that package. Joining us now to talk about this is Oregon Democratic Senator Jeff Merkley, who voted for that bill. Senator, your sense of what this bill is going to do. Obviously, markets are off today, but we've had a couple of record-breaking days. In fact, we've had the top 3 days in the stock market since the Great Depression. So clearly, some people are getting the impression that this may have some meaningful effect, but there are a lot of people who say it can't possibly be enough.
Well, Ali, it's a massive infusion of funds into the economy, and it's for those workers who are laid off, it's going to give them 100% of their income for most low-income, moderate-income workers. It encourages small businesses, and by that we mean really up to 500 people, to keep their employees employed, which will allow the businesses to recover faster when we get to the other side of this. This has a lot in it that is going to help medium and large businesses being able to access the Fed 13.3 window, and a massive investment in healthcare, $130 billion. and a stabilization fund for the states and local governments. So that's just the headlines. There's lots more beyond that on things like agricultural and housing and education.
Are there things in this bill that didn't get done that you think should have or might have to happen in another bill?
I think support for our small chambers of commerce is very important, and that is not in this bill. Our 501c6 small chamber of commerce are going to play a big role in making sure that the small businesses are able to sign up. I don't think we have enough for our public universities and our nonprofit universities. A lot of them that are in the quarter system are going to see, or at least they are afraid they're going to see, a massive erosion in their tuition as we start the third quarter here at the end of March or the beginning of April. And I don't think we have enough on housing. I've been pushing for a $40 billion housing package. We got about $7 billion. Housing's already very stressed across the country, and this could put a lot more people onto the street.
I want to just play for you some of the criticism that's come from some circles, some Democratic circles on this. New York Congresswoman Alexandria Ocasio-Cortez had this to say about it. Let's listen together.
What did the Senate majority fight for? One of the largest corporate bailouts with as few strings as possible in American history. Shameful. The greed of that fight is wrong for crumbs, for our families. And the option that we have is to either let them suffer with nothing or to allow this greed and billions of dollars, which will be leveraged into trillions of dollars, to contribute to the largest income inequality gap in our future.
Senator, there were, in fact, virtually no strings attached in the initial draft bill of $500 that would go to American corporations. That has been strengthened to some degree, although the president yesterday implied that cruise companies, if they flag their ships in the United States after having not done so for decades, might be able to participate in this thing. So there's still some feeling that the $500 billion that goes to corporate relief doesn't have as many strings attached as some people would like them to have.
Well, that's right. It was passed in a Senate that's run by Republicans. They were going to make sure that this liquidity was there for medium and large businesses. We wanted a lot more strings attached to it. We got some. The most important is massive transparency. The details have to be disclosed within a few days of exactly who gets what. The fact that none of these funds can be used for stock buybacks, that was an improvement. There are restrictions on how much executives can be paid. That's an improvement, but it's not strong enough. This was always going to be a compromise in which Democrats were fighting for the unemployment insurance and the small business, the things that really hit families or help families right on the ground. We got those things. Republicans got more leniency with the big businesses than we would have liked, because we think there is room for abuse. I think AOC is right on that.
Senator, good to talk to you as always. Thank you, sir. Senator Jeff Merkley of Oregon. Now that the House has passed the pandemic relief bill, the direct payments will soon be on their way. The Treasury Secretary, Steve Mnuchin, says payments are going to start in about 3 weeks. That's how long it took last time. And here's how you can get the money as fast as possible. First of all, here's a reminder of who's eligible and how much the payment will be. Individuals who earn less than $75,000 a year will get $1,200. Couples who file a joint tax return and made less than $150,000 a year will get $2,400. Individuals who file as a head of household and earn $112,500 or less will get $1,200. You'll also receive $500 for every child in the household. Those are the full payments. Now, it goes down from there. Individuals who make up to $99,000, couples that earn up to $198,000 will receive money, but the amount will be reduced by $5 for every $100 of income above $75K for individuals and $150K for couples. You must have a valid Social Security number in order to get the money, and the Social Security number must be the kind that is eligible for work. There are some Americans who have a Social Security card that says ineligible for work without authorization. You don't get the money then. The IRS is going to determine how much you get by looking at your 2018 or 2019 federal tax returns. If you filed in 2019, that's what they'll look at. If you haven't, they're going to look at your 2018. Here's the thing you need to worry about. If your information's up to date, meaning your address to which your last refund was sent, or that was on your last tax return, you don't need to do anything at all. If If you haven't filed taxes for either 2018 or 2019, now's a good time to do it. You'll get the money faster if you've signed up for direct deposit, by the way. The IRS will send the money directly to your account. It's going to take longer if the government needs to send you a check. Now, all of this is on my Twitter handle, @Velshi. So go in there. I've put it all down there. It's got to be 8 or 10 tweets. But there's a lot of discussion here, and there's a lot of questions about this. So I want to bring in my colleague and friend, NBC News senior business reporter Ben Popkin, to answer some of these questions. And Ben, one of the largest areas of concern people have are those who don't fit into the categories that I just described. That is seniors on Social Security, people who receive Social Security disability benefits, people who get pensions but not Social Security, low-income Americans who don't file enough to make enough to file a return. Talk to me about these groups.
Definitely, Ali. Both you and I have heard a lot of concern from our readers about these very same issues. The bottom line, what people need to know is almost every adult American will receive one of these checks. That is the bottom line. Now, those questions, those on Social Security, disabilities, will they get stimulus checks? Yes. No matter what category you pull up on disability, receiving benefits, that has no impact whatsoever on whether you'll get one of these checks. People wonder, will this disqualify me? No. There's a lot of confusion because the IRS is involved, and people are scared of the IRS on a good day, I think. But really here, the IRS is just the mechanism for determining eligibility and then sending out those checks. People, though, who do not have enough income to file for taxes normally, they should probably go out and file taxes. You can declare zero income. You can send in a tax form that has zero income. And if you need help doing that, you can go to irs.gov. They've got the forms there, of course. There are also community groups, and there's also a service called the IRS Volunteer Income Tax Assistance. And they're groups, they're tax preparers specially set up to help people making under $54,000 a year who have disability or issues with English. Now, of course, because of coronavirus, many of these tax assistant offices are closed, but it's still worth giving the phone number a call and trying to find out. There's a lot of information that is still up in the air until the bill is completely finalized, but the IRS has set up a landing page, irs.gov/coronavirus, and you've got the customer service phone number for the IRS. Yes, the IRS does have a customer service line, and 800-829-1040. They'll be able to answer some of these questions, at least as far as people who are catching up on things like back taxes, filing, which is something that is typical. So we'll see what happens. The other thing to remember is these may not be the last payments. People, they need help month to month. So I'll be interested to see if this is just the beginning of extension of the social safety net due to the coronavirus.
Ben, do me a favor, tweet out the website for the IRS coronavirus and that phone number. I'll do the same thing. You and I will keep people posted on this. Ben Popkin, NBC News senior business reporter. Worth noting that in 2009, it took 3 months for the government to get these checks out. We're told it's going to take about 3 weeks right now. There have been cuts to the IRS itself, so that's another question. The other thing you should know is even if you owe the government money, back taxes, that won't affect you with one exception. If you have unpaid child support that has been reported to the Treasury Department, this will be deducted from that. So that's the one exception. If you have unpaid child support, you're not going to get this rebate. The big question now is this relief package going to be enough? Joining me to talk about this is Annie Lowrey, staff writer for The Atlantic. She's also the author of Give People Money, How a Universal Basic Income Would End Poverty, Revolutionize Work, and Remake the World. And I'm hoping, Annie, that in people's spare time, this is the book that they are buying right now, because it's really, you and I know, because we did this the last time in the financial crisis, it's every 12 or 13 or 15 or hopefully 20 years that we get to have this much influence over what Ben Popkin just called the social safety net. This might be the time to reconsider all of this.
Yeah, absolutely. We saw major changes to the safety net that came out of the last recession, including eventually in a separate process, the creation of the Affordable Care Act. And I don't think it's impossible to think that we will see pretty profound changes to the social safety net through this one, through the provision of public goods, possible changes to things like paid leave. And so I would expect that to happen because, you know, to your earlier point, I don't think that this is the last rescue bill that they are going to pass. I think that they're going to have to come back. Depending a little bit on how this goes in public health terms.
You know, Annie, whenever I cover hurricanes, it's one of the other things I do. We talk about climate change. And there are all sorts of people who say, this is an emergency. This is not the moment to talk about that. Same thing's happening now. People are saying, this is an emergency. Get these checks out. This is not the time to restructure our economy. But this may be the opportune time because people's ears are tuned for the conversation around universal basic income and things that sort of can create a safety net that protects us from shocks like this in the past, because we will have them.
Absolutely. And so there's been an ongoing conversation about whether the country needs what are called better automatic stabilizers. So these are the programs that kick in when families start to become distressed, and they don't require an act of Congress. One thing to note is that this did require Congress to come together to pass this. They didn't have off-the-shelf programs for this, and we didn't have a ton of programs set and ready to go. And so I think thinking about if there is another viral pandemic, do we need automatic cash payments to immediately go out? I think there are many people on the Hill who are starting to think about that, starting to think about structural changes so that it's not always on Congress to do this and to remake these policies again and again and again. And I think that thinking about cash policies is going to be part of that going forward. Do we want to have better, more immediate and more direct support for families, even when times are good? Just as a general point, the United States has much less social insurance than other countries do, which is a bit of an irony because we pay so much for health insurance. But nevertheless, we are relatively uninsured compared to our peers in rich countries.
Yep. And wealthier. Annie Lowrey, for people stuck at home who are thinking of reading more stuff, get the book. It's called Give People Money. This is the moment to understand universal basic income and stronger social safety nets. Annie, thanks very much. Annie Lowrey is a staff writer at The Atlantic. We've got breaking news, and this is serious. Emergency responders in New York City are getting more 911 calls than ever before. There are so many calls that people, not just a few people, a lot of people are being put on hold. The city is strongly suggesting that New Yorkers only call 911 if they're having trouble breathing or having heart problems. Otherwise, call your doctor or call 311. NBC News correspondent for investigations Tom Witter has been following the New York City, New York State developments for us. Tom, anecdotally, a lot of our colleagues are talking about not having heard this many sirens on the street since 9/11, and I can confirm that you are constantly hearing sirens, and they are now overwhelmed.
That's correct. I'm going to read you a statement from Deputy Commissioner Frank Dwyer from the fire department. He says the medical call volume for EMS in New York City over the past 3 days is the largest in our history. That's an extraordinary statement, Ali. As you said, there is an awful lot of ambulance activity. Now, this number is constantly fluctuating, but right now there's approximately 170 people holding for ambulances in New York City. Now, I want to make it right away a major caveat there. If somebody is at home and watching us right now and they're having a heart issue, possibly a heart attack, or they're having serious trouble breathing, your call's going to be prioritized. Don't think that you're in a hopeless situation. The 911 operators and the 911 system in New York City is very good about prioritizing calls. But the issue that the fire department EMS has right now is that these EMTs and paramedics are being run ragged because there are folks that are calling that are feeling sick. They might have coronavirus symptoms. They might have flu-like symptoms, and they're not sure what they have. They want people to get help, but what they're asking you to do is to call your physician, or if you're in New York City only, call 311. That's an information service that the city has, and that way there your physician can best advise you what to do, what steps to take, how serious your conditions might be, and where your treatment can go from there. They do say, look, if you've got those heart issues, like I said, or trouble breathing, it's definitely
definitely give them a call. They'll find a way to prioritize the calls and get you the help that you need. But the system is being clogged for folks that are just feeling sick. And while nobody wants that, and nobody wants anybody to be feeling ill, there is a lot of illness in New York City, as we know, and as you've been talking about, Ali. So bit of a concerning situation, bit of a serious situation. The fire department's asking that we get this message out. We're going to be doing the same on our local television station here in New York as well. So just a little bit of a public service announcement, as you will, but also an indication of what's going through people's heads, fear, a lot of sickness. So it's something that we're going to continue to monitor, Ali.
I'm hearing, as you're talking to me, I'm in my home broadcasting this, and I'm listening to sirens. It's just not a common thing that you hear in New York as frequently as you do, but this will happen in other cities. So the point is, wherever you are, if you have an existing condition, know how to get hold of your doctor. Know whether they're texting or they're using telehealth or they're, you know, figure that out. Because, as you said, they are responding to emergencies, but there are a lot of calls that are on hold right now. Tom, thank you for continuing to report on this. I would follow Tom Winter on Twitter if you're in New York State, because he is keeping up to date with all the numbers in the city and the state. Thank you, Tom. As we've been discussing, Florida has one of the highest numbers of coronavirus cases in the United States, nearly 2,500 people. It's also got a desperate need for protective equipment and supplies. And to help combat the unprecedented demand, owners of a distillery in Volusia County, Florida, are using their rum-making skills to make hand sanitizer for police and emergency workers. They open the door every day to a steady line of customers. Joining me now from outside the distillery in Holly Hill, Florida, is NBC News correspondent Kerry Sanders. Kerry, what's the situation?
Well, Ali, they're doing such a good job, they've now expanded it to the public. This is what everybody's been after, but if you go to a pharmacy, you go to a grocery store, it's very hard to find the hand sanitizer. So what they're doing here at the Copper Bottom Craft Distillery is they are producing the hand sanitizer. And joining us right now is, at a distance from me, of course, is Jeremy Craig. He's one of the co-owners, but more importantly, he's the chemist. So you guys shifted gears last week. You started producing. How much are you making?
We've handed out just shy of 500 gallons of hand sanitizer.
500 gallons.
Yeah,
what was the transition, changing gears from making rum to this like?
The great thing is we produce ethanol on a day-to-day basis. We have the equipment to produce high-proof alcohol, and that's the main ingredient in hand sanitizer.
When this crisis first began, people were desperate to get brand names like Purell, in part because it had that FDA stamp on it.
Right.
How do they know that what they're getting here is going to be effective, and how are you dealing with the FDA?
So the FDA last week, I believe it was, actually lifted some of their regulations to make it easier for guys like us to produce hand sanitizer because there's such a need. We have guidelines from the World Health Organization and the FDA on what the recipe we're supposed to be using, and that's exactly what we're using in this.
Well, we thank you for what you're doing. The community thanks you. They're not charging for these, as a matter of fact. What they're doing is taking donations, and as you pointed out, Ali, first responders, because they are the ones who, unlike us with our 6 feet of space between us, or actually a little bit more, first responders often have to go right up to somebody. They don't. And so this is effective, useful, and quite frankly, I saw an officer who, on his holster, on his gun, had a mask hanging on his gun, and where you would normally see in his utility belt some mace, he had a bottle similar to this right there. It was a sign of the times, certainly in the age of coronavirus.
But it is also a sign, Kerry, in that in the absence of leadership in expected circles, Americans are showing that leadership. They're looking out for each other, and they're proving that we are actually all in this together. Kerry Sanders
American
in Holly Hill,
ingenuity,
Florida,
you gotta
for
love
us.
it.
Well, that's right. That's right. As coronavirus precautionary measures force historic job losses in this country, there's finally some promising news for thousands of gig workers. New York's highest court ruled on Thursday that Postmates food delivery drivers are, in fact, company employees and therefore entitled to state unemployment benefits. Apologies, as we say, we're working from home these days, so there are technical difficulties from time to time. I implore you to stay with us. We and our Internet providers are all going to get through this. New York's highest court ruled on Thursday that Postmates food delivery drivers are in fact company employees and are therefore entitled to state unemployment benefits. Now, the majority of the appeals court judges agreed with the state that Postmate couriers are not independent contractors because the company has sufficient control over the work that they are doing. Many delivery and the ride-hailing car services like Uber and Lyft have fought criticism of their classification of workers and their refusal to provide minimum wage, overtime, or unemployment protection. New York Attorney General Letitia James, who made the announcement, calls the decision, quote, a huge victory for thousands of gig workers across New York. She joins me now on the phone. Attorney General, thank you for being with us. Important to note, this case has been going on for a long time. This had nothing to do with coronavirus, but it becomes suddenly significant in that a lot of Americans are going to get unemployment benefits who otherwise weren't qualified for them.
All right, I don't think I've got...
All right, I don't think I've got Letitia James. Is that correct? Just going to check with my control room. If
I'm here. Hi, Allie, I can hear you.
Ah, there you go. I'm sorry. Here we are. We've got you. Talk to me about this, because this case has been going on for a while. But what's the impact on a whole lot of people who are now out of work and who might qualify for unemployment insurance? All right. We are definitely having a problem connecting with New York State Attorney General Tish James. We're going to try and get her back, but let me just move on until we can figure that out. There are a lot of challenges in getting the news out these days. We're all learning and we're getting better at it. Attorney General Bill Barr could soon order that some of America's oldest and most vulnerable inmates be sent home in light of coronavirus. Now, prisons have already implemented some precautionary measures, such as limiting visitors. 10 inmates and 8 Bureau of Prison employees, by the way, have already tested positive for COVID-19. And according to new data, there are more than 20,000 inmates in the federal prison system who are in their mid-50s or older. So we want to take a closer look at what can be done to protect these vulnerable populations as the virus continues to spread. Joining me now is Dr. Salman Khashoggi. He's a professor of social health and medicine at Harvard University. He's a physician in the Division of Global Health Equity at Brigham and Women's Hospital in Boston. Dr. Khashoggi, you and I were talking about this, the idea that prison populations, you've worked in prison populations before, studying the spread of infectious diseases. This is a really dangerous place for us to have people in close quarters who have no control over their ability to social distance, if you will.
Yeah, absolutely, Ali. When you think about it, when you're in a prison, you are crowded together and you eat together, you move around in very specific ways. You can't control what you can clean. You can't control how many times you're washing your hands necessarily. So there's a lot of issues around prisons. And we've had outbreaks of a number of diseases in prisons, including things like tuberculosis and flu, et cetera. So we know that prisons are at very high risk.
What can be done? What have you seen done to try and accommodate a prison population short of letting people out, which some people are considering and asking for?
Well, you mentioned letting people out. So I think on a very administrative level, people that don't need to be in prisons or jails shouldn't be there. And those are the people that may have trouble paying bail or things like that. They just shouldn't be there. But after that, you can take a number of administrative steps. So the first thing is that you can separate the sick from the non-sick, which means that you have to test people. And you end up with 3 groups in the case of coronavirus. You'll have people that have it. You'll have those that are exposed to people who have it, and those people should be watched. They should be, in some way, what we're doing at home now, quarantining, and then there'll be a group that doesn't have it, and they can be separated. So you need to have 3 administrative spaces to put people. And then you really have to test the people who are exposed and the people that don't have it regularly. And you have to make sure that new people coming into the prison are tested and monitored, before they're let into the general population. So, just like what we're doing in the civilian population, you have to do it in the prison, but because it's more crowded and people aren't as spread out as when we're all in our separate homes, it becomes a little bit more complicated.
Salman, stand by. I want to bring in Joyce Vance, former U.S. attorney, who is one of 400 former U.S. attorneys, DOJ leaders, judges who have written a letter urging President Trump to do what you were just talking about. Joyce, you're talking about releasing vulnerable individuals, commuting sentences. You know, one of the things Salman said to me yesterday is that we could turn a whole bunch of people who are thieves into having death sentences because of coronavirus.
Well, I think that's true, Allie, but we have to be smart and sensible about what we do here. There's good data that indicates that once federal prisoners turn age 50, they're a much lower risk of recidivism when they're released into the community. So there are good reasons to take offenders who are nonviolent, who are elderly, who are close to the end of service of their sentence, and remove them from the prison population to make it more possible to take preventative measures in prison to relieve overcrowding. At the same time, you can't release these folks without a plan. There needs to be a method in place for them to self-quarantine for 14 days upon release to ensure they don't take infection home. They need to have housing. They need to have access to medical care. The Bureau of Prisons is well ordered to do this. The Bureau has a motto that says that reentry begins on day one of incarceration. That means that they begin to think about a prisoner's eventual return home on the first day they go into custody. Now we need to put those plans into place in a smart way that benefits communities and people that are incarcerated.
Salman, you had done some work in Russia, and you say that they actually, for unrelated reasons, did do this. I don't know if it was an effort to reduce prison populations or just look at how they sentence people, but they did end up releasing a lot of prisoners.
Yeah, you know, Ali, in that case, it was another airborne disease, tuberculosis. And the Russians, of course, in the post-Soviet period had as many people as we have in our prisons today. So, you know, amongst the largest prison populations in the world. And so they looked at people who didn't need to be there. They looked at people who were elderly, people who were infirm, et cetera. And they sent a lot of people home. And I agree with U.S. Attorney Vance that we have to, be sensible about it. I think if you look at our prison population, about 10%, are over 50, 55 years old. 10% of the entire population have diabetes and other such conditions that predispose you to these infections. So we could look at people that might be safe, and then as she's mentioned, we have to think about where they're going to go, and that kind of opens the door to thinking, 600,000 prisoners every year leave prison and enter the community. And so we have to do the prisons right, because you can't have an epidemic going on in a prison and then have people moving back into the community with coronavirus, or else we won't be able to stop it in the community. So getting the prisons right and the transition out of prison right is really, really critical.
Well, this may be one of those things where we have given thought to, but we haven't implemented, and maybe the crisis causes us to get better at the way we think about incarceration and sentencing. Thanks to both of you for joining me. Dr. Salman Khashoggi, professor of social health and medicine at Harvard University, physician in the Division of Global Health Equity at Brigham and Women's Hospital, and, of course, Joyce Vance, former United States attorney and an MSNBC contributor. New York Attorney General Letitia James is back with me. The third time is the charm, Attorney General. I was saying when we last talked or tried to talk that this has been a long time in the works, this whole idea of Postmates workers as employees rather than gig workers. But it has new significance now in this moment in which people are being sent home and that some people are going to get unemployment checks.
Yeah, this is a huge victory for Postmates workers and potentially thousands of gig workers across New York and across the nation. The courts have basically affirmed what we all knew was true, and that is that delivery drivers are employees and are entitled to the same unemployment benefits other employees can obtain. As the nation battles the spread of the coronavirus and more employees are laid off, Postmates drivers should know that they have the same safety net millions of others in New York have. And this obviously will set a precedent for other cases that are currently pending and gig employees as a whole.
How does it, I mean, this is the one big difference. When we compare things to things we remember, we compare this maybe to the recession in 2008, 2009. This is one of the big differences, right? The number of people in our economy who are now freelancers, contractors, gig workers, for whom the social safety net that some of us don't think was good enough anyway are almost non-existent.
The business model obviously has changed. Time has changed, and things have changed on the ground. And the reality is that a number of gig workers are obviously looking to this decision. And I want to thank, obviously, Congress. As you know, Congress just passed a bill which would include gig workers for unemployment, those who have been affected by the coronavirus. And that's for the very first time in history, they will extend payments to freelancers and to gig workers. And I think, obviously, the courts are catching up with the times and recognizing that these gig workers and Postmates and others should be entitled to unemployment benefits, and that there should be a safety net in place for these employees.
Attorney General, before I let you go, there has been an issue with price gouging, with people hoarding and price gouging. You have taken some action on this. What can you tell us right now about the state of what happens to people who price gouge on essential items right now?
Yeah, we have received in the Office of Attorney General right now around 4,000 complaints related to price gouging. We've received a number of complaints, around 2,000, related to medical scams, individuals who are online platforms indicating that they've got cures to the coronavirus, or they've got treatments to the coronavirus. And we have also received, unfortunately, a number of complaints related to hate crimes. I want everyone to know right now there is no cure, there is no treatment, there are no antibodies that can cure this virus. And two, that individuals who take advantage of the anxiety and the fear that currently exists, not only in New York, but across this nation, there will be cease and desist orders that will be issued to you, and we will take actions against you seeking temporary restraining orders. Right now, we've issued over 800 cease and desist letters. We have not had to go to court to seek any temporary restraining orders. I'm glad a number of businesses have complied with our cease and desist orders, but our office is open and operating. Most of our employees are operating remotely from home, but we do have some dedicated staff members who are handling our phones. I want to thank them for that. But most importantly, what I want to tell all of your listeners and all of your viewers is that everyone should remain calm. Everyone obviously should focus on facts, and everyone should know that as one nation, as one state, that we will get past this.
We will get past this. We're in it together. New York Attorney General Letitia James, thank you for joining me. Take a look at that market right now. It's had a sudden sharp drop in the last little while. We're now off about 770 points, 3.4%. We were in the 2% range, but that's why. That's the unemployment insurance claims that came out yesterday. That's a big deal. Soaring to a record-breaking 3.3 million. Just look at that chart. That goes back to 1967. Look at that spike. As coronavirus begins to take a toll on the U.S. economy, and after the nation watched the markets crash at lightning speed, lawmakers in Washington obviously got this $2 trillion relief package through. But now that the United States leads all other nations in the number of coronavirus cases, it's not clear whether this is going to be enough to do it. Joining me is Robert Reich. He is a former U.S. Secretary of Labor under President Clinton. He's the Chancellor's Professor of Public Policy at the University of California at Berkeley. Bob, you and I have we've been talking about the structural problems in the economy for years with respect to labor and wages and workers, but now it all comes into sharp relief when we've had this exogenous shock that is causing numbers that we have not talked about before, including in the last 12 years when we talked about the recession. What do you make of what you're seeing right now?
Look at Al. The problem here is not joblessness. I mean, this is joblessness that is necessary in order to protect the public and protect individuals and families from this virus. This is not a matter of stimulating the economy or getting jobs back or doing any of the normal things we do during a recession or an economic downturn. The public health issue is the #1 issue here. People have got to shelter at home. That's what this is all about. That's why we're seeing these kinds of figures of unemployment insurance claims. And at the same time, we have a new bill just through Congress, just enacted, or at least by the Senate and the House. And it does not, in my humble opinion, does not provide nearly enough aid to individuals. That's $1,200 per adult. That will take the average family through maybe a week. But this virus is expected to require sheltering at home for at least the next the next 2 months, possibly the next 3 months. The more people do it, the more people are sheltered, the faster we will be through this. But it's not going to be 1 week, and that $1,200 is just not going to go far enough.
What does it look like? Is it more $1,200 things that Congress does? Is it a real conversation about universal basic income? What are the things we can do that can be more structural in nature rather than emergency in nature if this thing carries on or has effects that take us through for months?
Well, the good thing in the bill is an increase in unemployment insurance, using the unemployment insurance system that we already have in place, but making it far easier for people, including gig workers and contract workers, to get unemployment insurance. Now, that's the good news. And it's also good news that it's for 4 months. That is it's a $600 above what people can ordinarily get from unemployment insurance. But we've got to make sure that the system is capable of reaching people very, very rapidly. I hear over and over again, because I used to be labor secretary, I know how this unemployment insurance system works. I hear over and over again that people cannot get into the unemployment insurance system. Phones are jammed. It is very, very difficult. People are overwhelmed. It's very important that we gear the system up very, very rapidly. This is, 80% of Americans live paycheck to paycheck. And so being without a paycheck means that you have huge numbers of people who are not going to be being able to pay their bills and their rent and get the food they need. The other thing that's vitally important right now is to expand Medicaid assistance really to anybody who needs it, so that nobody is deterred from hospitalization because of the costs of medical care.
Robert Reich, I thank you for your time, and we thank you at MSNBC because we know you've been spending a lot of time on our air. Our viewers will be familiar with your analysis at a time when we need that analysis as seriously as we do. Robert Reich is the former Secretary of Labor under President Clinton. He's now the Chancellor's Professor of Public Policy at the University of California in Berkeley. Let's take another quick look at that market. We are now off 4% for the day, about 900 points on the Dow. That doesn't put us, I'm just taking a look at my charts here, we're not yet into the top 10 point drops of the history of the Dow, but we're getting there very, very close. We have had 3 solid days for the last 3 days where markets and investors have been cheering on Congress in their ability to get a deal done. This is sometimes what you call buying on the rumor, selling on the news. The market is a little bit exhausted. A lot of people who hadn't sold their stocks may have been taking the gains of the last few days in order to do that. But at 900, if we cross 970 points, we've made it into the top 10. I hope we don't. I don't like records like this. Right now, we're off 900 points. All 3 major markets, by the way, are in the same place. Now, let me just bring you perspective, as I always do. This is bad right now. We're probably off about 21% for the year. 21%. I mean, you're supposed to be making 7, 8, 9% in the average year. We're off 3 times that right now. But I assume most of you didn't start investing just a year ago. Over 5 years, this market is up 25%, 24.32%. Over 10 years, it's still up 119%. If you look at a chart of the S&P 500 over the last 20 years, you will see that despite a very, very sharp drop in the 2009 recession, that market is up substantially higher than it was even over 20 years. So I just want to give you perspective. I'm not cheering on the markets, and I'm not blaming investors for selling out. I'm just giving you some long-term perspective, which is hard to do when we cover the news and the markets minute by minute. That wraps up the hour for me. I'm going to be right back here at 10 p.m. Eastern for the last word, and of course Saturday and Sunday at 8 a.m. Eastern for Velshi. Thank you for watching. Deadline White House starts right after this quick break.